All right, welcome all to your Freedom Hub's presentation of free market cash patience. I'm your host today, Jeff Cantor, along with Charles Frohman, and definitely want you to appreciate that we are being sponsored by yourfreedomhub.com. And that's where we get to see all the disruptive activity that's been actually taking place within America that most people don't know because they're watching conventional news. Now, also, we want you to come to these into the future. So this is the site you'll want to come to, yourfreedomhub.com/cashpatient. And also all of these are recorded and they're available typically every Sunday afternoon at these various channels, depending on which are your favorite. And just be aware, because they are bit.lys, they are case sensitive. So that BitChute does require the lowercase and the uppercase as an example, as do all the others. Now, just so you're aware, we wanted you to be able to see kind of what happens if you're looking to see who our sponsor is. This is the site you'll end up on. This is the various videos that we're going to make available. And as you can see, there's a wealth of them across all the channels that you'll be wanting to see. So that's kind of where we're at the moment. Let's start to talk about what we're going to see and be finding out about today. So Charles, take it over from here.
Sure, Jeff, and welcome, Dr. Arshad. We're excited once again to feature your game-changing app for the future of medicine with cash-based appointments. Jawad is the founder and CEO of WoW Health Solutions. Previous to that, what kind of led him here is he ran and founded a clinic, Express Care, in Michigan. And before that, he was an emergency physician that rose in the ranks at the Detroit hospital there and ran the emergency medicine department. And we'll let him finish his intro and take us away. Thanks, Jeff.
Fantastic. All right, Dr. Arshad, please take the floor.
Great. Thank you so much. So appreciate the time, of course, and for everyone to be here. I am going to bring up some slides. As Charlie was mentioning, I'm an ER physician by training, and I've worked for quite a few years on the administrative side of medicine. And in doing so, and then becoming a small business owner when I started my own clinic, I really came face to face with our current payer system, right? So our app, our solution really is to bring some sanity to the delivery of care in our communities, right? Because we know that the best and the most transparent way to deliver care is for that patient to be able to directly connect with that provider or physician, and also then pay for that on cash basis, because that's going to be the most transparent and valuable method. So I'm going to run through with maybe about 10-15 minutes of some slides. We can open it up for some discussion. I can show you guys some of the software interfaces as well to hopefully kind of bring this home, right? So we approach healthcare from a cost challenge standpoint, right? So when we look at healthcare, we know that there are a lot of issues with it, but really spending money on insurance premiums only to be getting stuck with having to pay deductibles is a huge challenge, right? And that's what we wanted to correct. Because we know that these high costs lead to patient disengagement, right? And then this also leads to a feeling of lack of control. And this lack of control is not only felt by the patient, but the provider as well. When I see my patient, I can't really even tell them how much something that I am recommending is going to end up costing them, right? And so what we set out to do was create an ecosystem where we were going to recruit the provider back into taking care of their patient. And we do that by guaranteeing three things, right? We guarantee our providers that we would never dictate pricing. They can dictate what is appropriate and necessary for the service they're providing. We guarantee them that they will be paid that amount should they dispense that service through our platform. And thirdly, we guarantee them that we would never ask them to submit any claims or paperwork, right, to get paid. But to be fair to our consumer, to our patient, we do tell our providers that you are going to be part of a marketplace, right, where you are going to appear next to your peers with your pricing and your availability and so on. So now I, as a patient, if I'm looking for a pediatrician or a primary care physician or a holistic medicine provider, I can decide who I am going to see based on price and availability and distance and ratings and so on, right? But we know to bring scale and to really exact the change that is necessary, we have to bring the incumbents into this picture as well. And we'll kind of touch upon who those parties are as we look to grow. So what we're presenting to you tonight is a new paradigm of care, one which is truly patient-centric and patient-driven. And these words are used so commonly in healthcare that they've started to lose their meaning. But hopefully you'll see every step of the way our patient, that consumer, is really in charge of their care. But we know that healthcare is complex, so we do enroll and wrap all of our members that are part of a program, of one of our health programs, into what's called a care plan. Right? And a care plan is basically a suite of services. You have 24/7 access to a navigator. So you can speak to someone should you have any questions about how to make an appointment or any other relevant questions. You could have 24/7 access to a physician via telemedicine. We also bring you telepsychiatry and counseling services. And finally, we enroll you in our medication program, which many on this call probably are familiar with GoodRx, but our prices are usually going to be about 25 to 30% cheaper than that, because our pharmacy program does not charge anything on top of the wholesale price, because we pay them a monthly membership fee. But we know that these remote services and these memberships aren't going to address where care is dispensed, right? And care is obtained in person greater than 95% of the time. So when we look at your in-person care, we split it into two categories, right? So we say there's outpatient and routine care, and then there is the major medical stuff. Your ER visits, your, God forbid, diagnosis of cancer, your admission to the hospital, and so on. And the reason we split them is because, as you can imagine, the frequency of your major medical events across our whole population it's only about 7 to 8%, which means 90+% of the time, care is being obtained in this outpatient routine care setup. And of course, the price point between the two is completely opposite as well. So we're going to come up with some strategies how to empower our consumer to taking care of themselves. But before we get there, I wanted to sort of understand why we need this alternative model, right? So when we looked at the market, we saw that almost 9 out of 10 people that have a non-governmental insurance plan are getting it from their employer. And then when you look at employer data, you see that, gosh, healthcare is the second largest line item on their budgets. So for example, GM spends more money on healthcare than they do on steel, right? Which is something that's needed for their core business. And Starbucks spends more money on healthcare than it does on coffee beans, right? So here is an incumbent, because employers currently cover almost 160 million lives in the US. So here is an incumbent from the current system that we can recruit as part of the solution to really help drive our movement forward. And presumably people want health insurance because they think it will protect them against financial ruin. But when you look at data, it doesn't really pan out at all, right? Because A, healthcare costs are the #1 reason for personal bankruptcies in the US. And two, 75% of those individuals had health insurance. So just because you have health insurance, of course, doesn't mean that you have healthcare. And then when we look at the other side of the equation, when we look at our providers, they only collect about 30% of what they bill. So why am I billing $300 plus for a service that I'm only going to end up collecting $70 or $80, right? Isn't there a better way, a more transparent, direct way for me to collect that from my customer, from my patient? So as we're sort of working through this, we wanted to understand what the size of the market is, right? So when we look at CMS data, we know that there are close to 1 billion ambulatory or outpatient visits per year. Even if we take into account our high utilizers, we know that 5 out of 6 people see a medical provider at least once a year. So now we felt that, we had a reasonable understanding of the problem. Clearly, the volume is there if you could come up with a good revenue model. And the revenue model was really important to us because we wanted to make sure that we were going to be able to grow. So we did some marketing studies and we saw that, for example, an average office visit in the US currently pays between $60 to $90, right, depending on the geographic market. But when you look at your consumer data, you see that patients actually are willing to pay anywhere between $100 to $150 for those same visits. So we said, hey, if we could collect $100 from the patient, and even if we gave 80 of it to the doctor, we would still be left with $20 in what we could collect as a service fee for that appointment. And then, of course, we take that service fee and we split it, right? So we keep a percentage of it for ourselves as software vendors. We share a percentage of that service fee with our advocates, with our partners that bring users into the platform. And of course, the employer vertical is just one way for us to bring in a lot of users. And then we share a percentage of that service fee with our advocates that bring in providers into the platform, right? So this way, everything that's done through our platform is done on cash basis, but it is an open marketplace. So if I can bring in a lot of physicians and Jeff can bring in a lot of patients, everyone is going to generate revenue when those two parties meet. That's why we say that our advocates are really the pillars that hold us up, because they are ultimately responsible for bringing patients and providers into an appointment. And that is the simplistic model, how our system works. But to really implement it in the real world, we wanted to come up with some strategies that was going to improve our ability to bring the demand side, the patient side of the equation, so that we could directly benefit the provider side, the supply side of our equation. So when you look at outpatient or routine care, right, we're talking about your office visits and your labs and medications and diagnostics and so on. Really, once again, anything that can be done outside the four walls of a hospital. How you pay for these services is the question, right? And of course, the simplest answer is that the patient, the individual, can pay for it themselves. But we know that's quite limiting, not only in the number of people who can do that, but also the amount of money that would be at their disposal. So we brought in the employer, right? So through the WoW ecosystem, the employer can allocate funds for their employee that then the employee turns around and uses like cash. This can become a great recruitment and retention tool as well, because the employer actually retains control of those funds. So should the employee decide to leave, well, then they are leaving whatever unused funds that were allocated to them. That definitely improves our user, our patient's ability to pay, but we wanted to take it a step further, and now we've brought in a couple of health programs, right? And we'll kind of talk a little bit about each one. But basically what they do is they empower the user, the patient, to spend money that is allocated to them by the insurance plan, right? So in this case, now you have boosted the ability of your user to really spend money for these services. Of course, in the case of a major medical event, when we talk about your emergency visits, your dialysis care, cancer care, so on, right? Then we have a wraparound program that would kick in and help defray the cost from the user, from that patient. And I'll kind of stop with some slides after this, But really, we have two programs that we offer, right, through our platform. One of them is an ERISA compliant, sort of a more traditional looking self-funded insurance plan. In this program, in this insurance plan, the insurance company, the carrier, actually allocates funds, $20,000 for an individual up to $40,000 for a family in an HRA account, right, which basically is a cash account that belongs to the employer. And then money is allocated for each employee out of those funds. And the idea is that because the employees are getting this money, they become cash spenders in the system, which of course boosts their ability to obtain services and helps support the ecosystem of cash pay providers. Of course, in the case of a major medical event, then there is a stop loss carrier. There is an insurance plan that actually kicks in and takes care of those possibilities. This of course is something that really applies to employers that are, at least 25 plus lives. Ideally, you want to be about 50. The larger the employer, the better it is. Because unlike a traditional insurance plan, really the risk stratification is done on that group itself. It is a platinum rated plan, which means that 93%, above 90%, in this case, 93% of the expected cost to an individual will be picked up by the plan. We also incentivize the employees by shifting 100% of the upfront cost of the program to the employer. What this does is it makes the employees receive a small bump in their paycheck every month or every pay period because they no longer are contributing that 20 or 30% towards the premium of a health insurance plan. And because of that, they become a more willing participant in this exercise. Right? And then for our individuals, for our single member LLCs, our small employers, right, which is of course the great majority when it comes to volume, we have a medical cost sharing program. In this situation, what we've done is we've taken an HSA as a pre-tax vehicle where the individual, the patient, as well as the employer can allocate money into it, right? And then you build that up. You can even invest it, although given the way market has gone this past week, that may not seem like a great idea, but you can invest it and it can really grow like a retirement account for you. But when you need funds for your care, you can draw on that. In case of a major medical event, of course, then we have the medical cost sharing program through Sedera that assists that member with any expenses. So, our goal in setting up this platform was not to become the providers of care. Our goal, because when we looked at the market, we know that there are a lot of people who are providing cash-based services and are doing amazing things. The problem that we see is that there is not one standardized way for all of these providers to communicate with the patients, right? So we wanted to create that platform so that your users, your supply side, your demand side, your patients have a way to communicate with the providers. And that's what we have set out to do. And for us, our main target is to really empower our advocates to bring both the patients, the employers on one side, and the medical providers on the other side, so that we can all not only move this forward, but also generate revenues for our respective businesses. And I'll kind of stop here and Jeff, kind of take your lead, Charlie, how you guys would like me to proceed from here.
Sure. Well, that was very good, obviously. And to kind of put a little more context for everybody, let's start thinking about how the world is today and how it was or what would be preferred. So right now, everybody's setting price because, see, you're a member. If you go to the doctor or the hospital, it's like, well, how much is an MRI? I have no idea. What's the name of your health plan? So everything's kind of predetermined, and no one knows if that's really the right price. And then the doctor has no idea. They're just there to try to help people. So with that in mind, let's go back in a different perspective where we think, let's see, I'm the patient, I'm home, I'm sick as a dog, and I'm laying in my bed. And you know what would be awesome? If the doctor came to my house and took care of me. I don't want to get in my car and go to their office and sit there with a bunch of other sick people, especially today when everyone's all panicked anyway. So what happened to that relationship? Because if enough people are old enough or can remember, that was realistically how it was. Now, in the old days, they got paid with pies or goats sometimes. but if we had technology to apply, because see, I'm the most important person when I'm sick. I don't care about United Healthcare, Blue Cross, or anybody else's situation. I'm the sick person. And realistically, Medicare for all and all the rest of that, you know what's going to happen in the end? What would ideally happen? I'm going to physically meet with a doctor. It's a one-on-one relationship. So if that's my perspective and I want to be the controlling entity, I need something like what just Dr. Arshad just described. Because the reality is every price that's out there today is an arbitrary price. No one has any idea. Look is a good example for those that understand medical, the idea of LASIK surgery. Look where it used to be, what it used to cost, how much it costs today, and the quality of it today. So when the market is unleashed, we all get to figure out, you know what LASIK actually costs? Yeah, here's the price. But I have no idea realistically what an MRI should cost. I know what arbitrarily Blue Cross thinks it should cost. And I know arbitrarily what some freestanding medical MRI facility thinks it should cost. But what does it really cost? And so finally we have the ability to find that out, which is really amazing. And here too, you see, reality of a market is that it's a two-way street. See, if I don't like the way you are in my store, then I don't want to do business with you. So this app allows the doctor to be rated, so I can decide, this is a good doctor, I should go here. Their price is good, and this and that. Hey, maybe I want to go to Mexico. Their price is so good, or whatever it may be. But at the same time, that doctor is going to get to see, hey, 4 other doctors said this person is bogus. They come in and try to get opioid prescriptions all the time. So now we all sort of know the realities of who we're dealing with and who we'd like to do business with, so we can foster good activity without requiring legislation or any other nonsensical way to try to make the market work. The market works by itself when you let it. And that becomes the reality of where we are today with this situation. So, and it also therefore has pricing signals, like I said, because see now, for me, I always like to analogize the corner where there's 4 gas stations, and whichever one suddenly decides to drop the price by 10 cents has a line out of their driveway, but it's either forcing the others to either match that price or offer more services, that type of situation. So you and I, by voting with our feet and our wallet, decide what the price is. This is the first time ever we're going to all get to find out what the price is. So let's open up for some questions. Everybody, there's a raise your hand icon. So please feel free to ask away. We're going to have some thoughtful ideas, I would assume. You know what I'm actually going to do? I'm going to actually start with Paul, because I saw you had a chat question earlier. Paul, go ahead.
Yeah, no, I think it's great. Actually, I think it's a great product, and really, bringing the two together, the patient and provider. This is a great way to do it. So I guess my question, getting back to, I think it's if you have over 50 employees or under 50 employees, kind of demarcates the program that you would fall under as an employer, I presume. Is that right? First of all,
yeah, I mean, so it depends. Once again, the larger the group, the better, right? So certainly 50 and above, it becomes you have an obligation as an employer to present healthcare options.
Right.
So this obviously meets that requirement. But our carrier will go as low as 25 lives. Anything lower than that, and then you'll have to fill out a questionnaire, and they'll need to look at some of your prior data. Once again, the better the data they receive from the employer about, prior year spend, the better a quote that they can generate, right? Because otherwise they're kind of always hedging and thinking that if there is no data, then we've got to, perhaps put in a bit of a buffer into the premium.
And I would presume, correct me if I'm wrong, but if you are a larger employer, there's a larger risk pool, which I presume is the reason for having the catastrophic insurance kind of supplement versus the cost sharing. Am I onto something with that, or?
Well, yeah, one of the main reasons why you are into the insurance plan, especially if you're a larger employer, it's also because of Arisaco, and our this particular plan, for example, we were given the Innovation Award for it at the Ascend conference, and Ascend is basically a conference of some of the larger employer benefit managers, right? Guys who actually sell these health insurance plans to large employers. And the reason we were given this award is because we basically took your traditional insurance product, decoupled it, right, and said, we're going to pay for the outpatient and routine services through an HRA account, which once again is funded by the employer, so it's not coming from the employee's pocket. And then we're going to have the stop loss insurance product to cover for any major medical events. And in just that, right, you drop the price, the total price to that employer by about 15 to 20% minimum.
All right, very good. One of the ideas too is the fact that it's delivering a prepaid person. So the historical issue, and I don't know if you really emphasize this enough, but if for the average person that's a doctor, a lot of what they're having to report and put information out about is really meaningless. It's mostly just to try to collect from some insurance entity. And so that being the case, this really allows you to be able to really do the right thing by everybody as far as your own self and everyone else. So also here now I see that I have a hand up from Kishore. Are you there? Well, let's come back to that. I have Kathy. I have you out there, Kathy.
Yes. Yeah, I'm just now with the WoW app, whoever gets an employer or something gets on the WoW app, so they get charged for the use of the WoW app. How does the advocate figure in terms of what their role is? I'm trying to figure out what my role is.
I'm going to let Jawad come in a second, but let me just see if I can lay it out a little bit too. The reality is we're trying, the final mile is the doctor themselves. Teledoc is awesome. I live out in the middle of nowhere. I want to order a pizza. I can make a call that comes. I want to talk to a doctor about this spot on my arm. I can do it. But if something really is of any consequence, I have to physically meet with a person. There's no app for that. I have to meet with somebody. And so the reality is we can, contract with some lab, which has offices all over the country to get a set price on something like that. But that only goes so far. You still need to talk to some person. So that's where this thing really comes to the fore, is the fact that it really connects people to the actual end event. So what we're trying to do a la Amazon is that, let's say I'm or Etsy, if people know about that, I make handmade, bags for the grocery store because they don't like to give out plastic bags anymore. And I sell those on Etsy. Well, guess what? Etsy charges a little bit of money because I'm going to be selling my bag. Now you can call me direct, but is anyone going to find me with my little lone website floating around on the internet? Or everybody's on Etsy going, oh, I wonder where I can get a really good bag. And they find you like immediately. And suddenly it's like, oh, there's 4 other people that make cool bags. And I'm twice the price of everybody else. Oh, I wonder why I'm not selling any bags. So it really allows you to figure out where you need to be. And then also, if you're really good and the quality is either better, you can get more money, or your artwork is so good, you may have to match everyone's price. But I'm so much better quality and look that I get all the business anyway. So now the market's really working, and that's what this really delivers, is the ability to make that happen. And that's the most critical part about driving the market forward. So here's what ends up happening. So in a historical world, only a licensed insurance agent or a pharmaceutical company or others that are like in the industry can participate. In a normal world, I did one thing. I used to be a tailor one day. Now I run a restaurant tomorrow. You could do that. But now when it comes to this world, but here now suddenly everyone that's an influence maker and understands and realizes we have got to get away from the model. We keep trying to move around the deck chairs on the Titanic, and we're wasting all of this valuable time, and we just need to take a quick step to the right, and the next thing you know, everything's fixed. So the key part is, instead of just saying, well, I'm Amazon or whomever and I'm just marking it all up like Etsy, no, we're marking it up and we're sharing it with those people that brought that last mile, the hardest part of any transition. And how do you scale that last mile to the table? And in that instance, you get to share in those proceeds. So you bring the consumer, you bring the doctor. Let's say you were lucky enough to bring both. And that consumer goes, oh, I need to get this test, or I need to get this visit. And they book it with that doctor. Well, guess what? The platform, just like Amazon, makes a little bit of money because you could have gone to my website and bought that book directly. But you know what? It was a little more money on Amazon, but son of a gun, everybody and his brother was on Amazon, and hardly anyone ever came to my own website. Because you need that market square where everyone's going to see you, like being at the food court at the mall. Everyone's going to get to see everybody all at once and figure out where they want to go. And so from that standpoint, they're going to be able to buy into what you're doing. And that's going to be able to grow your business in a collective place. And that's what we've been lacking. Because let's pick a perfect example. Let's say anyone on this call likes to go to a chiropractor. Where do you find them? They're not covered by Blue Cross. They're not in that PPO directory book. How does that person ever get any business? But now suddenly everybody is in one place where suddenly all of us can be found. And now you compete on quality and price, which to the consumer is all that matters. And we cut out all of that middle ground, which has been eating up all of the money and all the value. So when people complain about healthcare in America, it's not about the quality of the care. It's the whole way we're trying to pay for all this nonsense. And it's become so egregious in the private market that now they're advocating for a government solution, which we all know, hopefully, that's going to be a lot cheaper, right? So that's a long answer, Jawad, but what would you add to what I just said?
Yeah, so I think, I would like to just remind everyone, think of your car insurance, right? Can you imagine if you had to bill your oil change to your car insurance? What would it do to your $20 oil change? It would just be ridiculous, right? So it's the same idea. Outpatient care and services are really affordable, especially if you haven't just sunk like $5,000-$6,000 into a premium of something that you can't really even use, right? If you had saved all that money, it would be almost free, right, for you to go see your doctor and actually take care of these things. So I think that definitely is there. Someone actually had asked the question that, how many providers and so on. So as Jeff was mentioning, right, so what we did is we've brought on a national vendor for lab services, okay? We have our own pharmacy program that is available at all CVS, Walgreens, Walmarts, whatever, okay? We have a partner that has close to almost 1,000 ambulatory surgery centers, right? So in case you need any procedures like a colonoscopy, endoscopy, a hernia repair, knee replacement, what have you, we can get you a price and a location for that. We also have close to 1,970 imaging centers throughout the country, right? So these are centers where you can go get your X-ray or CAT scan or MRI, but at completely transparent price, So MRIs usually cost about $450 to $500, when you pay cash for them. If you go through your insurance, I will guarantee you, because of markups and so on, it will end up costing you close to $1,000. So we have a lot of that what's called the continuum of care built out, and that's available right from even today. And I'll kind of show you guys on my app, if Jeff, you like, what that looks like. But what we are bringing advocates in for, right, is that last mile, right? As you guys know, for any delivery company as well, right, it's always that last mile of delivery that matters. So we're looking to advocates and saying, hey, go into your communities, right, and talk to those medical practices and providers that are open-minded enough to say, yeah, you know what, I am going to put my service and get paid transparently and on cash basis at the time of my appointment in a guaranteed manner, right, for the care that I am going to dispense. And we're not asking them to stop doing what they're doing, right? Diversify your payer mix. Right now, maybe 100%, 99% of the money that you make as a medical practice is coming from an insurance entity. Why not diversify it, right? Why not try to push that up, push that down to maybe 80% or 75%, and hopefully someday down to zero, right? Because you can get all of your care and all of your expenses met through a cash pay system. So I think so that's our goal. And then of course on the user side, right, we've brought in these programs, but these programs aren't the answer, except that they help drive the volume that is necessary, not only volume number of patients, but also the volume of money that would make it attractive and easier for our advocates to bring in those individuals as well as medical practices.
Jawad, I'm going to give you back the sharing controls. Why don't you show a little bit of what the app actually looks like here for a minute?
Yeah. So let's see. Okay. So let's see if you can see my phone. Right. The app, of course, is available on the App Store. So if you search,
and ideally, just to kind of cut you off on that front, what you're going to want to do is kind of get requested, because the key is for the app to be on your phone. You need to set an online profile,
right,
so that when you go to then pull down the app, you have a username and password to log in with.
Exactly.
Otherwise, the system doesn't quite work as in the right flow that you need it to.
Right. So what usually will happen is that an advocate, right, and in this case, for example, Jeff and their group has a website called wowadvocates.com, right? If you just go to that, you click on it, it'll land you onto our website. Now you can watch videos, you can see whatever else is going on, right? But what you can do as a user is sign up, right? So you can sign up as a patient. You can, of course, request to sign up as an advocate, in which case we will come back to you and figure out how you ended up with us so we can refer you to the right entity, right? You can sign up as an employer. You can sign up as a medical practice. So you can really do all of those things. But once you have signed up as a patient, I'm going to actually log out of my app and log back.
And while you're doing that, just to mention, everything you just mentioned as far as any of those different variants coming on board, it's all free.
Right. So no user pays anything. So we just need to make sure that everyone knows that the system is completely free for users to be part of. So even if that medical practice signs on, even if that patient gets the app, no one's paying anything. I understand we may not be able to drive you the business today, but you sign up today and hopefully in the next few weeks, we would be able to drive patients to you. So I'm going to log in with my Face ID because it's just easier. But this is the app, right? So you can see, for example, that I have my medical chart up in here. So any appointments, any tests that are done through our ecosystem, they are going to reside in your medical chart. So no matter which provider, which physician you go see next time around, they would have access to your records. When you are a cash pay patient, the last thing you want someone to do is just get a repeat test just because they can't get the results, right? You have your tasks folder where anything that is recommended to you by your provider during your appointment comes and sits. So if I'm told I should get an MRI, it would come and sit in my tasks folder. We have, as we had referenced, the care plan, which is essentially access to a navigator right? So you can call this person, and I'm not going to call it because you can call this person and they'll answer any questions for you. You of course get access to telemedicine, and you can request that call. Our teletherapy and psychiatric services, these are 50-minute online appointments, and they cost $20, but it's a great value because you can talk to a therapist and so on. And of course, then you have your pharmacy membership program. Your wallet is where you are going to have your personal wallet where you can manage your cards. So you have all of your debit or credit cards loaded here. As you can see, I have my 3 that are in here. I will show you in a dummy account, but basically you also, this is where your employer allocations would sit, okay? And I'll switch over to the dummy account just to show you that. But this is the live app. So let's say I am interested in making an appointment. I go to the appointments tab and I can create an appointment. So that MRI that I was referring to, so let's see if you can find out. So here is an MRI without contrast, right? And it is going to show me all of these centers. So this is our large partner that is providing this service, okay? So now when you click on it, you can read a bit about it. These are all of the other services that they also offer, right? And when I confirm the selection, I can actually fill this screen out, and when I hit proceed, it sends them a request. Now, MRIs obviously are not tests that you just walk in for. They do require to be scheduled. And so this will start the scheduling process, and then you will get a call. They will set the exact time and date with you, and then you will get typed out or written confirmation back into your app, which once you accept that in your final details, that's when you would pay for it, and then it would get scheduled, and you will get the address where to go and all of those things. Right? This is, of course, same place where if you wanted to create an appointment, for example, with a chiropractor, or if you were looking to speak to a holistic medicine provider, right? You could come in here and you would be able to do that, okay? Your marketplace is really where you have a lot of stuff, right? So medical practices, especially if you think about your direct primary cares, for example, but even otherwise, right? I mean, you know, a dentist may set up, for example, a braces membership, right? So it's going to cost $3,000, but it's going to include, you know, take over 2-year period, and it'll be 30 visits, right? So whatever it is, you can put some membership offers in here, and I will show you that a little bit actually in the demo app. So let me actually switch over to our demo app because there is some data in there for you to be able to see all of these things that I'm referencing. So this is our demo app. So as you can see, Kara, I guess, is some demo person. But in the memberships, you can see all of these memberships. So you can tap on it and you can read a bit about what that membership includes. And then if you like it, you can subscribe to it. Right? You have your major medical programs, and that's where you can get your insurance plan. This is not something that obviously you can purchase through the app because the insurance plan actually runs through the TPA. However, you can, as an individual, sign up for the Health Excellence Plus program, right? Which is the HSA with the Sedera that Jeff's and Charlie's group brings. So you, of course, you know, you can have your minors, so you can add children into your account. There is an informative videos folder, so you can watch all of these videos. They're all like 30 seconds to a minute, so they're fairly short, but they will give you an insight into what each one of these features within the app do, right? And then the hamburger menu is sort of fairly self-explanatory. So that's the app interface that our patients that are consumers are interfacing with.
One thing interesting to point out about what you've been showing here is that, you know, in terms of how this works, either on the individual small capacity program or that larger group, usually most people, they don't have a lot. They're not having a heart attack this year.
Right.
But they're going to have that oil change, and they got to get this. They got to get a car wash. So, that's the real reality. So no one's going to hit their deductible. And then on top of that, let's say the stuff you spend money on is like going towards the deductible. It's not going to add up to be enough. So the way this works is at least the person's got cash either in their HSA or from their wallet that the employer supplied. So really they have like no costs per year to actually have health care. And then if the trucks come off the rails, they're ready to go when it comes to something like that. But what's nice about this too, when you show that membership, is when, let's say I'm looking, like you said, chiropractors. Well, there's a lot of chiropractors maybe in your town. What's the difference? Well, the ones that have a difference can have a special package or something they're offering in there. So I sort of analogize it to that you've got all this listing, which is kind of like the yellow pages of the old days, but there's always a certain people that have a big block advertisement. They've got something really special that they do that sets them apart from the run-of-the-mill practitioner. And so now it creates an incentive, which actually the doctors really like the idea of trying to compete to get business as opposed to just being listed in some PPO directory that's run by Blue Cross and Blue Shield. So it is pretty neat. So let's get some more questions. I see Kishore's got his hand up.
Yeah, Christina just wanted to know how the tasks work, and I just
go
kind of
ahead.
wanted to address that the tasks are basically, at the end of your appointment with the physician, if the physician says, hey, I think you should go see a cardiologist, I think you should go see, or you should get an MRI, you should get a CAT scan, you should get this blood test done, or get a stress test, or what have you. That's just where it kind of comes and sits for you to be able to tap on, and then, it's fairly straightforward how you can make an appointment to get that done.
Very good. Sorry, didn't mean to cut you off on that last point.
No,
Go ahead, Kishore.
Yeah, so, my question is about what exactly we mean by transparency. And I want to make a complimentary remark that Jeff just made, is when you are looking for therapies, you're looking for not only the best doctor, but also the best course of treatment. You could have the same symptoms could be relevant for, let's say, alternative medicine, and what alternative medicine can do, the regular medicine can't do. So the first thing is, do we go to alternative medicine? If we go to alternative, what therapies are available? If we go to regular one, which therapies are known to work well for the same symptoms? Or do we go to a specialist? So, so in terms of what you mean by transparency, I want to find out, does it include specialists? Seems like it's more about primary care, alternative care, and labs. So the scope, what do you exactly mean by transparency? So the wallet that you're talking about, does it cover specialist care without something equivalent to a catastrophic insurance, or I guess you would need some kind of insurance for specialist care?
So, I mean, I think when we talk about transparency, we are talking about your care episode, right? So we want that to be transparent. So you know how much that episode of care is going to cost. We have absolutely no desire to steer what type of care you need, right? We are not trying to educate you, and we are not trying to steer you towards naturopathic versus, allopathic care. Okay, that's not the purpose of our company, and that's not the purpose of this app. Okay, where you get that care recommendation from is somewhere else, right? If it's your primary care doctor, your best friend, whoever it is. Okay. When you talk about, needing coverage, especially for specialist care, for example, okay, so I don't know how many people on this call know, but, if you are a cardiologist, or if you are a specialist, or what have you, you only get paid about 10% more than a primary care physician for that office visit, right? Even though it may seem like that's not true, but it is. because the specialists make their money not on consultation, they actually make their money on procedures, right? So a cardiologist, when they do an echocardiogram, or when they do a heart catheterization, or when that orthopedic surgeon puts a cast on you, or when they operate on you, okay? So if you are going to go see a specialist, it's not going to cost you anything more than 10% or so. Now, if you need a procedure on top of that, then certainly transparency comes into the picture, right? Because you should be able to see, if I need that back injection, how much should that cost? So that when my specialist is telling me I need a back injection, it's going to cost me, $5,000. Well, on the WoW app, it looks like it's only going to cost me $2,500, right? Now, it's totally up to you. You may decide that the extra $2,500 spend is worth it, right? And because you have such a great relationship with your provider and you think that's fair, and that's okay, right? We're not here, once again, to, I think, legislate what you would like to do, right? We're just saying, here is some facts, and you go ahead and make the decision what you feel is appropriate and correct.
Yeah. So
that
I want to clarify this facts thing. What do these facts mean? Because that's what is transparency. Often the complexity is that you have certain symptoms, and the cost will depend on what treatment course you take, right? Or its effectiveness will depend on. So if there was, for example, feedback from other patients who found, for example, let's say stomach bleeding, right? They chose this course of action, it cost them this so much. They went to a specialist, it cost them so much for this kind of treatment. So without that information, it's even hard to compare.
Yes, but what is clear is that if you do have blood in your stool, that you are going to go see a physician. So it'd be nice to know how much that's going to cost you. When that physician sees you and tells you that you need to have, a CAT scan done, it would be nice for you to know how much that thing is going to cost, right? After the CAT scan, when they tell you that you need that colonoscopy, it'd be nice to know how much that colonoscopy costs, okay? And then after the colonoscopy, when you are told that you may need surgery, it would be nice to know what kind of surgery, how much is this thing going to cost. So when we talk about transparency, because, when you sort of lump it all in, right, it's not that, all of a sudden everything got addressed on one day, right? It's a process. And it would be nice to know what the cost of that, each step of that process is.
Well, there's another way of looking at it. That's a good example, right? So you could also give information, let's say a guy who has stomach bleeding went to a naturopath first and he got treated right away, right? You didn't have to go through all this long process and realize that was a waste of time and money.
Sure.
Well, the reality too, Kishore, is that that's not the app's purpose. That's more like the person themselves, because again, we're putting you in control, and then who are all of your trusted advisors. So this app is not producing any content or any feedback or anything whatsoever. It's just a place to make transactions and appointments and other things occur. What's nice, what's really is nice about it is the way that it's so agnostic. It's just a functional piece to make all these just separate elements happen. So, again, like I said before, chiropractor is not listed in a PPO's directory, but now they're all intermixed with everybody else. So suddenly everybody's on a level footing. If your store is next to my store in the mall, I don't think less of you. I suddenly think you're on parity, even if you're like a 2-bit operation. The other one has 500 locations. Hey, you both have great signs, great stores. I think you're equal. And so suddenly this is the great leveler to really let those practitioners do what you said. And that's why we're really focused, because we're all with you as far as the realities of how you do prevent and take care of yourself. How do we promote those businesses? And now we've got a forum where they're going to get a chance to outpace those allopathic type medicine as time goes by. All right, well, we're up here. So this is where everyone's going to want to go for more information. You want to go to wowadvocates.com, and you'll be able to find out all the details of what's to do and what's path makes sense for you, because you may be a patient, a doctor. You might actually have some areas of influence, you want to be an advocate. So we'd certainly like to have a chance to talk with you about it. And Dr. Arshad, I definitely want to thank you for being here today.
No, thank you. It was a pleasure, and thank you for the opportunity, and of course for everyone to spend their evening with us. I think that's amazing.